One, you should appreciate that we were able to avert the notice. And Akechu rightfully said it, this devolved function, we have shared responsibilities. There's what is supposed to be done by the Ministry of Health, there's what is supposed to be done by the county governments. Employers for doctors, really, those who work in the county government, their employer is the counties. If you are to negotiate a salary, who do you negotiate with? Your employer. So they cannot come to the Ministry of Health to negotiate their salary. They will negotiate with their employer, who is a governor at the counties. So from the strike notice, we sat together, and that is to tell you the beauty of this government, that everybody wants to make it and achieve it for the Kenyans. That we were able to bring together the Council of Governors, the Ministry of Health, to be able to discuss the issues. And we eventually unpacked those issues into, I think there were about 9 issues or so. And out of the 9 issues, then we said, okay, this one is national, this is the Ministry of Health, and this one is county. The issues that were for Ministry of Health majorly was posting of interns, which you have seen. We have already posted. And I've said we have improved that process, that moving forward, they're not going to talk about it. It's a continuous exercise. That then we know once this cohort has finished, another cohort moves in. So we have put in a mechanism to ensure that that doesn't drop off. We continue. Other issues that they raised, that is solely the responsibility of MOH, is further studies when it comes to specialization. We are already having a conversation on that, and we have asked for data from KMPDU in terms of the doctors who have arrears that have not been settled by this ministry. And once we get that data, then we prioritize in terms of budgeting on how do we get to meet. We may not be able to pay all of them at a go, but we are able to have a plan in terms of being able to meet the payments. A number of issues that were raised were actually to be met by county government. And from the meetings that we had, we agreed on when the Council of Governors is going to meet to be able to thrash out the issues that are supposed to be taken care of by the county government, like the issue of basic salary and all that. But remember, in my earlier discussion, I have said we want to be a negotiator and a mediator to be in between them. That the issues that are supposed to be handled by the county governments, we provide an enabling environment for them to be able to discuss. And if possible, then we can have a centralized mechanism of handling the healthcare workers, not just doctors, but all healthcare workers. Because the health workforce is huge. The nurses, the clinical officers, the lab people, the biomedical engineers, there are many. So we want to have, we will be in between in terms of the discussions, just to ensure that then we have a centralized mechanism on how we handle the whole scope of the health workforce, because they are very key if I'm to deliver on UHC. They are the pillars, actually, that you have the hospital in terms of the structure, but you must have a health worker to be able to deliver on UHC. So those are conversations that are ongoing. The truth is, I didn't quite anticipate what this position really is. I think on my appointment, it was overwhelming, yes, together with the excitement. But once you start working, then you realize, oh, it's not what I thought it was. And therefore, I'm having to work extra hard, extremely, really. In fact, for people who know me, they say that I have already lost weight. But I want to believe is because we are just at, you know, like when a plane is just about to take off, you know, there's a lot of, it's called what? Taxing or something. That is where we are at. That so far it's been very busy. So far, I cannot even say that my sleep pattern is consistent. There are days when there's too much, so you have to be awake up to very late into the night. There are days when they are a bit easy, so you don't, you sleep a bit early and wake up moderately early. But it's quite something. The things that I used to take for granted, that I could just walk around and do 1, 2, 3 things, now I can't do them. It's a shift for sure. My friends that we just used to meet and chat and have coffee and eat fries on Moy Avenue, I cannot enjoy that. Yeah, because of the nature of the work. That there's a lot to be done. And right now then is just being able to see exactly what fit will work best. Of course, I'm cognizant of the work-life balance. Eh?
Yeah.
Yeah, I am cognizant of that, so I try once in a while. In fact, my son has been asking me, when I come back, he says, "Oh, Mom, you're back." Then he asks the next question, "So when are you leaving?" So that is the way it is. But I'm sure along the way, there's going to be some form of balance in terms of then we have achieved some form of consistency. Yeah. And I'll have known my teams very well. At the moment, I'm still learning them. I have very experienced technical people here, people who have been here for n number of years. They have a lot of information. I can only leverage on them in terms of being able to move forward. So I'm still learning my teams. I think once I have learned them, then I know, oh, if I'm going to be away, so and so can do 1, 2, 3 while I'm away. Then that now will create the balance that I'm looking for. Yeah, but for the time being, a bit hectic.
Actually, I wanted to add on to Angela's question.
Yes.
It's been 4 months now. Has this position affected how you interact with your family? And on top of that, has it given you also a level of patience in how you interact with your staff on a daily basis?
With my family, yes, things have changed because I'm not available the way I used to be available. Let me tell you, I said that just before I got here, I was working for UCSF, Global Programs. From the beginning of COVID, up until the time I was appointed to report here, I was working from home. I said it was paperless. So you could work from anywhere. Global Programs has an office in Westlands. But from the beginning of COVID up to my appointment, I was working from home. We only go to the office once in a while to compare notes, to do a meeting maybe with external people, one that maybe we could not be able to do on Zoom and all that. So that shift. I was always home with my family. Of course, working and telling the child, hey, keep off, I'm working from this minute to this minute. But now, I'm required to be here physically, at least for the beginning. Yeah, to be able to function well and to fit in, and also to learn what is the culture around here. So what different culture would I bring in? It has affected in how I interact with my family. I'm not available most of the time. But as I've said, once I get into the balance and the hang of things, I'm sure I'm going to be available to them. But they understand. That is the biggest thing about it, is that it's, to all of us in the family, it is like, oh, so this is what it meant. Yeah. So they understand that it's going to be a bit rough. Yeah. In terms of, you asked about the staff around?
Patience, yeah.
The patients?
Patience now, yeah.
Yes. I have come from a place of appreciating people. As a leader, you can never move forward without people around you. So one of the things that I did, and the staff here will tell you, and they told me that it has never been done before, I had an all-staff assembly one morning. We all stood in the parking lot. And people were wondering, when I said I want to have an all-staff meeting, they were like, how? It has never happened. So how do we procure the tents? How do we get the chairs for people to sit? I said, no. People are coming to work. It's a normal working day. So let us just meet. Before they get into their offices, let's meet in the morning. And it happened. So I'm a believer that if you work with the people around you and you carry them along, that you communicate the vision properly, they get aligned to it.